Now that we have done the normal morphology of the P wave and how does the wave look in the frontal plane as well as in the horizontal plane, we will now be discussing what happens to the P wave in case of right atrial enlargement. And after this, we will be looking at what happens to P wave in case of left atrial enlargement. So just like we did the normal P wave in frontal plane and the horizontal plane, we will be discussing the changes that will be happening in the frontal plane and the horizontal plane. So first of all, coming to the axis, now we know that the normal axis of the P wave is somewhat from between 45 to 60 degrees. But the P wave in case of right atrial enlargement is shifted to the right of plus 60 degrees. Thus the P wave are tall in leads 2, 3 and AVF. So if we look at the figure on the right side, which I've drawn in the pink color, you'll see that as previously talked about, the lead 2 is placed at plus 60 degrees and it's the best lead to see the P wave morphology in a normal heart. But when there is right atrial enlargement, there will be shift in the net vector produced by the right atrium, which will be more towards the right. That is, it's going to be greater than plus 60 degrees towards this side. Hence, we'll be having now a number of leads in which we can look for the P wave, and it's going to be lead 2, 3 in AVF. And even in general, if we talk about even in the normal heart, the leads 2, 3 AVF are really good leads to look for the P wave morphology, and within those 3, the lead 2 is the best one. Similarly, when we have right atrial enlargement, we'll be looking for the changes in the P wave in the leads 2, AVF and lead 3. So in summary, when we talk about the axis of the right atrium will be shifted towards the right in case of right atrial enlargement. So now coming on to the contour. The contour of the P wave is peaked and pointed. So just to recall, the P wave contour was smooth and well-rounded in case of a normal P wave, but here when we have right atrial enlargement, we will be having peaked and pointed P waves. So these changes are often described as P pulmonale. Now, why do you think that the change is called P pulmonale? It's because the right atrial enlargement is frequently caused by pulmonary disease. So the reason we call it P pulmonale is because most of the cases of right atrial enlargement are due to the presence of a pulmonary disease. It doesn't mean that 100% of the times whenever you get right atrium enlargement, that is always because of the pulmonary disease. There could be other reasons as well, but most of the times it's because of the pulmonary disease. Hence, we call it as P pulmonale. Now coming to the amplitude and duration. So the height or the amplitude of the P wave will increase from the normal, that's 2.5 mm. And when we talk about the duration of the P wave in case of right atrial enlargement is not prolonged. Now, I would really like to discuss further in detail why is it that the duration is not prolonged, because when we will be talking about the left atrial enlargement, we will see that the duration is prolonged. So the reason for that is that the right atrium is activated earlier than the left atrium. Okay, and any delay in the propagation of the impulse from the enlargement of the right atrium will coincide with the activation of the left atrium. So if you look at this figure below, we have the sinus node that's present on the right atrium. Okay, so the impulse that is generated by the sinus node will first activate the right atrium and then it will move towards the left atrium. So in case of right atrial enlargement, even though the impulse will take a longer time to travel from here to here, because now this is the new distance that it'll have to cover, but this time will coincide with the activation of the left atrium. We will not see increase in the duration of the P wave. So now if we look at the figure above, we see that the best leads to look for the change in the P wave morphology are the leads 2, 3 in AVF, because these recording electrodes are actually facing the vector produced by the atrial activation. And if you see, the P wave is pointed here and it is more than 2.5 mm or more than 2.5 small squares, but the duration is still less than 2.5 mm or 2.5 small squares. So this is very important to remember. Just commit it to your memory that in the leads 2, 3 AVF, in case of right atrial enlargement, you will see peaked and pointed P waves with increase in the amplitude but normal duration. And why is the duration not increased? Because even though the dimensions of the right atrium have increased, but the activation of that extra part of the right atrium will still coincide with the left atrium and finish on time. Now coming on to the precordial leads. Now we discussed about the normal P wave morphology in the leads V3 to V6, which was upright. And when we talked about V1 and sometimes V2, it could be upright, it can be inverted or biphasic. Okay, so this was the normal morphology of the P wave. So when we talk about the right atrial enlargement, we need to know that in the lead V1, there may not be any significant P wave changes. The P wave remains normally upright, biphasic or inverted. So the only difference that we see in the lead V1 in case of right atrial enlargement is that these upright waves are gonna become more pointed and taller sometimes, okay? But the inverted part of the biphasic wave, or just the inverted portion, if the wave is completely inverted, will not be changed, okay? So just the upright portion may become a little bit more pointed or peaked. So I just want to spend some time on this normal sinus P wave in the lead 2 and lead V1 and try to find out what will be the changes that will be happening in case of right atrial enlargement. So when we talk about lead 2, we know that the P wave is rounded and smooth, but in case of right atrial enlargement, it will be peaked and pointed, and there will be increase in the amplitude by more than 2.5 mm, whereas the duration will stay same or it will not be prolonged. Now when we come to the lead V1, we know that in a normal ECG, in a normal heart, in the lead V1, the P wave could be upright, biphasic or inverted. But when we have right atrial enlargement, the upright portion of the biphasic wave can be peaked and sometimes taller, and also the upright wave, the plain upright wave, can be peaked and taller. But the inverted portion and of the biphasic lead and just the simple inverted wave will not change. So I just want to take some time and discuss the direction of the right atrial enlargement. The reason why I am spending some time on this is because if you know the direction of the right atrial enlargement in both the frontal and the horizontal planes, you will actually be able to make out the changes in the vector of the P wave in case of right atrial enlargement. So when we talk about the frontal plane, and if you see the figure here, especially the shaded area, that's actually depicting the direction in which the right atrium will enlarge. So in the frontal plane, we see that the right atrium enlarges in the downward direction and slightly towards the right. So this is the downward direction and this is the right, okay? Downwards and to the right. When we talk about the horizontal plane, the right atrium will move slightly interior. Okay, so it will be moving slightly interior, which is hard to tell in this figure, but you just have to imagine that the right atrium is kind of coming out of the screen. So this is how the right atrium enlarges. Okay. So through this figure, we know that in the frontal plane, the right atrium enlarges downward and to the right, causing the shift in the P wave axis to the right. Okay, and in the horizontal plane, the enlargement of the right atrium is slightly interior, which may cause slight peaking of the P waves in the lead P1. So this is a 12 lead ECG showing right atrial enlargement. Okay, how do we know that it's right atrial enlargement? Because we can clearly see tall and peaked P waves in the leads 2, 3 and AVF. Okay, so this is the lead 2, 3 and AVF. You can see that the P waves are peaked and they are of more than 2.5 mm amplitude, but the duration is not prolonged. So we know that the best leads to look for the P wave changes in the ECG or the leads 2, 3 AVF in case of right atrial enlargement, and that's what we have done here. We have looked for the peak and tall P waves in lead 2, 3 and AVF, and we were able to find those changes.